discuss the present and future impact of COVID. And to share their views, we have a panel of experts from across different industry verticals, right? So by the end of the session, we are hoping that each one of you would have got a different perspective and would have broadened your horizons as well.
Unique and new, and that's how Cognition conclaves is the first thing which occurred to us. And along with that, we also have opened up, WOW has branched out into a music school as well. So as you all might be aware of it, we have opened up instruments and Carnatic, along with Carnatic vocals, the Carnatic instruments are also being taught at World of Wellness.
So these are some of our flagship programs as well. Right, so educational systems are online and not everybody are comfortable with the online mode of education. So even students and young adults are facing problems with that. So very well answered. Thanks to the audience.
Personal and professional life. So it was like no more professional life stress management versus personal life stress management, but it is altogether a new method of managing stress and anxiety.
Fourth speaker, Dr. Raghavendra Kurkal. Dr. Raghavendra is a medical doctor and works as a general practitioner, a family doctor in the National Health Services in the United Kingdom. He also has a master's in health informatics. He has also worked in hospitals in India and in healthcare IT companies before coming to UK. He brings with him more than 15 years of work.
First of all, congratulations, Vinay and Karthik, for 4 wonderful years of wellness so World of Wellness, sorry. So amazing, and I'm so proud of everything you're doing and wish you all the best for the future. So impressed with everybody's talks and thanks for asking me to speak today. So I'm going to speak from a healthcare perspective and also from my own personal perspective as a general practitioner working in UK. I just need to say that it's a totally state-funded healthcare, free at the point of care. So there might be certain things that we do differently in UK compared to the rest of the world. But yes, it has affected us just as much as the rest of the world, just slightly differently, as I said, because it's state-funded. So the first thing is there's definitely change. We are more familiar with the fist bumps because of COVID rather than the traditional English method of greeting, which is the handshake. So gone to the fist bump or gone back to the namaste, which us Indians do. Just a quick background slide really to say COVID-19 is a disease caused by a virus, severe acute respiratory syndrome, coronavirus 2, first identified in Wuhan, China, 2019. So that's why the COVID-19. 1/3 of patients are asymptomatic. So that's another interesting thing. People don't quite understand to start with why they have to make any changes or isolate. Most of them have mild symptoms, and very few will have severe symptoms. And there is something called the post-COVID conditions, which affect people, especially for more than 4 weeks. So I just wanted to say, older people and people with underlying health conditions do get more severely ill, and then the vaccines have been a real breakthrough. So they're safe and effective. Just to quickly say, in terms of the numbers, initially in the first 11 months, there were about 71 million cases worldwide and 1.6 million deaths. And then the current number is, just checked yesterday and today, it's about 190 million confirmed COVID-19 cases with about 4 million deaths and 174 million recovered. So that's good. And then we've already gone past 3.4 billion vaccine doses administered. So that's the global situation. So quickly going on to lockdown, which was the first thing we heard about as a way to stop the spread. And we were all asked to stay at home and save lives and work from home as much as possible. And that's what we had to do as well, because as you can understand, in healthcare, we do have a lot of face-to-face contact because of having to examine our patients and so on. So what was previously a very, physical contact, face-to-face contact appointments was now transferred to telephone and video consultations as much as possible. So that was an immediate change we needed to do. So the challenges were just similar to what Ram mentioned about securing laptops. So some of us had laptops, but the screens were smaller compared to the desktops we had at work. So we had to sort of fit in with that smaller screen. There were security issues because it's medical records in England. In UK, we've got electronic patient record for everybody. So we had to make sure it was secure to use our laptops, and sometimes it was too slow. Everybody logging in between 8 and 9 in the morning made the systems crash. But we had to adapt, and that started to improve over a period of time. Patients were anxious, so they were wanting to know, what they should do if they were short of, breathless or just nervous to go to the hospital because they didn't want to get an infection if they didn't have one, and they didn't want to spread it. They wanted to do the right thing. It was all very stressful, and we all had to come up with our own coping strategies as staff and also our patients, teaching them to breathe, teaching them talk. I think it's probably the most I've talked about yoga to my patients, and meditation and breathing exercises to help them with the anxiety and stress. So it's a way of coping. Walks, and when we had lockdown, we would exercise inside the house. But the initial period when COVID hit, there was this huge adrenaline rush to fight, like Raj mentioned, that almost was like a war zone. And for those of us who are in healthcare, we felt we were the foot soldiers, we were the front line, and we were the front line. But so were other people who were stocking the shelves in the supermarket, and people who were caring for vulnerable people were the front line. So so we felt that boost of energy. I don't know if this graphic is working, but that boost of energy with adrenaline to do more than the call of duty. And then after a period of time, after 6 months, you feel so exhausted, there's just no energy to even do what you were able to do easily, but now that is also difficult. So a lot of people, getting burnt out, wanting to resign, being tearful at work or at home, and just not coping with the demand. So this is a picture of me trying to see patients who are asymptomatic. So that was the limited PPE I had. So because I was seeing patients who didn't necessarily have COVID, but needed to be checked. So if they had tummy pain or something else that needed looked at, and we couldn't make that decision on the phone or a video consultation, so we would bring them in. So that's me. But then, of course, if you had all the features of COVID, the fever, the cough, and loss of smell or taste, then you needed you must have seen this on TV and that sort of thing. But so the impact of all this was obviously in many different ways for everybody, but the psychological element for people who lost lives, the family of people who lost lives, so the bereavement process, the disruption to normal life, the social isolation, so the physical aspects of it as well. So if you're lucky enough to survive the recovery period, and for those people who lost their jobs because the industry just wasn't there to keep them at work, But I feel that the suffering has brought out the best in the human spirit, So although it was not been easy, the mindset, I think this is globally I have seen, is that we are together in this and we must overcome these challenges collectively. So there's that spirit about, looking out for each other and helping each other, that actually, as Raj mentioned in his slides, that it did bring out, when your backs are against the wall, that you reached out to your neighbor and asked, if you can be of some help to them, or brought their shopping for them. But the broader picture in healthcare is that there's been a very high pressure, probably an all-time high. The direct pressure from COVID-related illness itself is massively contributory, but then routine surgery and cancer treatment being postponed. So there's a massive backlog of patients who have not been accessing healthcare and not, the diagnosis has been delayed, and unfortunately, therefore losing lives prematurely when they could have been saved if it was not for COVID. So here on, the key learnings is that I think everyone working together, when obviously in a war zone, we all pull together, and this is a crisis that's affected the whole globe. So I think if everyone is responsible for the overall success, so whether it is hands, face, and space, or whether what you are doing to protect your neighbor or your family, or whether it was lockdowns, you made the sacrifices that the whole community could keep the infection level down. So that saved lives. Of course, through collaboration, scientific collaboration, we got the vaccine success, and that's probably the way out of the pandemic. And of course, we needed to innovate to provide care. So some of the things that has happened is we do now encourage our patients to have their own BP monitor at home, and also for people if they want to measure their own oxygen levels. But what's massive has been using mobile phones to do telephone consultations. So some of the patients, we have a software called Accurix, which allows us to send text message and pictures, and store that picture on the medical record. And video consultations, again, WhatsApp is good for that, or Attend Anywhere is another video consultation software. And we were doing a lot of electronic prescriptions anyway, so there was no paper contact to start with. So that's gone, whatever the small percentage that wasn't being done electronically is now pushed for it. And one of the recent breakthroughs, I think some of the doctors knew about it before. As I said, some are more technologically savvy, and having two screens and working whilst you're dealing with something is also clearing some prescriptions through the day. So we are working a bit more, multitasking and doing stuff. We have actually got back to work faster than everybody else. There is a real keenness to get back to face-to-face. I somewhat disagree with some of the things, but with IT it might be different. But there's a real keenness for face-to-face. There's something about it that humans we need to be face-to-face, especially when we're dealing with difficult things, to make sure, team meetings where I feel that people are not pulling their weight, and you want to talk about difficult issues or work management. But obviously there are situations where people are geographically in different locations, and then the online video works, so the MS Teams video or any of the other software. Email consultation is also going to hopefully take off at a higher level because of, again, because the backlog and not being able to meet the demand that's happening. So email consultations for non-urgent things. There is a new thing happening where the US has been doing this for some time. I don't know if India will do it as well. A lot of people who are called physician associates, nurses who are got a little bit more training. The physician associates are people with science degrees and who got a little bit extra training in adult medicine, will work alongside doctors. They may not be able to prescribe, but they can get the doctors to authorize prescriptions on their behalf to meet the patient demand, so possibly happening as well, going to happen in the near future. Future generally seems to be something we feel like we need to do more work collaboratively. We need to work harder to be successful. Obviously, a lot more innovation, a lot more collaboration is needed. And the world needs to be prepared, monitor what's going on, and obviously, as a world global community, deal with the unpredictability of the COVID-19 variants or other threats like the climate change. We need, as a community in the world, need to deal with it together. I want to close by a couple of personal perspective and what my message would be to humankind, if anybody was listening, is that life is tough. It's finite and it's fragile, as you have all appreciated that through the pandemic. But there is immense possibilities with a mature mindset. So we need to make that choice, because it's not going to happen. So same with, whether it's happiness or not, we have the choice to do that. We can choose to be happy. We can choose to be content. We can choose to, look at the positive. So that is the mature mindset I'm saying. We can choose to help others. So I would like to go back to our dharma, which says paropkaram idam shariram, which is our body and life is meant for the service of others without expecting anything in return. So I think if we can follow that principle in anything and everything we do, we will feel that we are all connected and responsible for each other on this planet. And so we'll be able to do our best to help one another and stay connected. And I think that is my message. Look out for one another and help one another. And I think that will be the overriding learning from this pandemic, and which we hope we can continue. And thank you again for staying and listening to the talk. Thanks.